Well, good morning, everybody. It's so nice to see everybody for our regular meeting of the Training Wheels Office Support Group. This month is our special guest is Dr. Heather Herrema. She's a movement disorder specialist with Central Neurology up in St. Petersburg. She's my movement disorder specialist. I'm actually going to see her next Monday up in St. Pete. And so she's going to talk to us on a topic that's near and dear to everyone's heart, the need for exercise with Parkinson's and why that's so important. So without any further ado, I'll turn it over to you, Dr. Herrema.
Thanks, Roger, and thanks for inviting me to come talk. It's funny, pre-COVID, I gave a ton of lectures and then they kind of went away, and now they're look a little bit different with Zoom, but I really appreciate the opportunity, and I'm glad to hear that exercise is important to you guys, because if you are my patient, you know that I ask about it at every single visit, and to some patients discuss it ad nauseum, but really it is because it's so important. So do you guys typically do questions at the end, or how do you?
Yeah, we'll do a Q&A in the end if that's okay with everybody.
No, that's fine. I was just going to say, if you want, feel free to interrupt me if you have questions. You know, I want you guys to get what's important for you out of this. So kind of moving forward, I always have liked, hold on. How do I move? There we go. So what we're going to be talking about today is, first of all, just a little bit of an overview of the kind of motor impairments we see in Parkinson's disease, the various types of exercise that patients can have. We're also going to talk about what symptoms we can see improved with exercise in both the motor symptoms and the non-motor symptoms. And then we'll focus on this role of, is exercise neuroprotective, which is really a hot area of debate, or I shouldn't even say debate, of research right now in Parkinson's. And then also talking about specific exercises to do, as well as, you know, some things to do at home. I know everybody kind of has different feelings on group exercise classes. So making sure that you're finding something that fits your needs. And then a little bit of tips to keep you motivated. And I've thrown in some comics in there to lighten up the topic. So let's talk about motor impairment in Parkinson's. So obviously, as you guys know, I always love, someone once referred to Parkinson's as a designer disease, meaning you guys know when you get together as a support group, everybody has a different set of symptoms. No two patients with Parkinson's look the same. You know, I always give the example that a third of patients in Parkinson's don't have a tremor, which that number really surprises people because it was used to be called the shaking palsy. So the disease itself is pretty heterogeneous, meaning looks different person to person. But when we look at patients with Parkinson's and compare them to their peers of similar age, we notice that overall, patients with Parkinson's seem to have decreased muscle strength, decreased walking speed, and decreased postural instability, or I should say more postural instability. So all of us, if we're kind of having that feeling of feeling unsteady, have this reflex that kicks in to keep us upright. And as most of you know, with Parkinson's, that is impaired. Like, a lot of times patients fall and I ask them why, and they're like, I don't know, I just sort of lost control. So that is a component of Parkinson's. Typically, we don't see it early on. It tends to come a little bit later in the disease for most patients. But again, every patient looks a little bit different. The postural instability and gait dysfunction are associated with worsening activities of daily living and increased number of falls. And as I'm sure you guys are aware, I think one of the #1 goals in Parkinson's is to avoid falls, because falls can lead to serious injuries, hip fractures being one of the more common ones, but head injuries and other things like that can happen. And I always tell my patients, the goal is to keep you out of the hospital, because in Parkinson's, I think if any of you have ever been hospitalized, you know that it's tough. Most of the nursing staff does not understand your disease. They inevitably mess up your medication regimen. They give you meds you're not supposed to have. They don't get you out of bed enough. I mean, the list goes on and on. So my goal is really to keep patients out of the hospital. And one of the ways, I mean, obviously other things can happen though, is decreasing the number of falls to keep them safe. There is also, you know, sometimes when patients are really fighting me on exercise, I throw out that there is a statistic that as people age, a hip fracture is associated with 50% mortality in 1 year, which is a pretty scary statistic. my orthopedic husband is trying to tell me that statistic is changing a little bit as technology advances, but it is there. And some of the reasons are the exposure to infection, the exposure to anesthesia. Anytime you're hospitalized, you typically lose muscle mass pretty quickly because you're pretty inactive during that period. So again, my point of exercise is to keep you healthy, keep you upright, and do it safely so that we can keep you out of the hospital. Hold on, sorry, I'm not doing a good job. Okay. So I kind of went over this, but essentially, why are we exercising? One, keeping you healthy, keeping you safe. Another thing is, there are medications in Parkinson's, as you guys all know, but some of the medications are designed really more so for things like the tremor, the stiffness, the slowness of movement. There's not a lot of great evidence that the medications for Parkinson's disease actually help with balance. Now, occasionally a patient will say that they've noticed that, but overall, there's not a lot of proof of that. And that goes along with DBS too. So to keep you upright, really exercise is the treatment. So keep you functioning. So typically when we look at the studies that have been really interesting about exercise, just to kind of give you a little background, and we'll talk about this more, is there used to not be a ton of data on exercise in Parkinson's. So I did my fellowship in 2013. And at that time, we were kind of starting to see some of these studies come out. But even my fellowship director, who was, a couple generations older than me, was not pushing it to the degree that we are now. And that's because the more data that has come out looking at patients with Parkinson's who are exercising, we see they have better walking, better balance, their flexibility is better, their motor coordination is better. And overall, they tend to have a lower mortality rate, better quality of life, and increased function of their ability of activities of daily living, which ultimately increases their independence. So I think we still have a long way to go in terms of learning exactly what exercise is doing in Parkinson's, but the studies are really starting to show how important this is. So the question I always get is, well, if I'm going to exercise, what should I be doing? And that answer is not black and white. For sure, in the data, there is not a single exercise that we know to be the most effective. Typically, I tell patients, and I think that this is true whether you have Parkinson's or not, but you can't do the same thing over and over again, because the more you do something, you develop something called muscle memory, and that's not challenging the brain. So I like when patients do a combination of some kind of aerobic exercise, getting their heart rate up. That's where the intervals comes in. Some kind of stretching, because both with age as well as with Parkinson's, you start to lose flexibility, and that's incredibly important. And then resistance training. And that's one I cannot stress enough. I mean, I have a lot of patients that are willing to go for walks and things like that, but for whatever reason, there's a lot of resistance, no pun intended, to the resistance training. So I always tell you, again, we can't correct for, what's going on in the brain as far as that postural instability. But if you have a strong core, and I really define core not just as having a six-pack, if you will, but having, strong abdominal muscles, glutes, hips, quads, and hamstrings, you are going to be less likely to fall, because those things are going to be able to help you recover when you get a little unsteady. Not to mention, with age comes the increased risk of osteoporosis. And so we know that resistance training is very important for patients with osteoporosis. So definitely adding that to the regimen. Like I said, it seems to be the one that people are a little more resistant to, but I really think is important. So again, no one of these things is superior. They kind of all need to be there. There needs to be some variety, both, for challenging the brain as well as your body. So in terms of aerobics exercise, when we've looked at patients who have Parkinson's disease that do aerobic exercise, one, we see overall improved aerobic fitness. That is important. I always tell patients, when we're looking at managing your Parkinson's, it's usually not Parkinson's alone. A lot of my patients have back issues, like I heard you guys kind of talking about when I jumped on. Many have cardiac issues, diabetic issues, stroke history. So having good aerobic fitness can help reduce your risk of cardiac disease, which we don't need to add more things to, your overall health issues. We see that patients who do aerobic exercise have improved motor function. They have more fatigue. And this is kind of this classic debate that I have in the office where patients are like, well, I'm so tired, that's why I can't exercise. And unfortunately, you just got to break the cycle, because I promise you that if you exercise regularly, your fatigue scores will be down. And then we also see improved mood. So we know the role that exercise plays in releasing endorphins. And we know that in Parkinson's, mood disorders are common. And so you will see improvement in both the apathy, the depression, the anxiety with exercise. And then overall, when we've looked at studies of people who exercise with Parkinson's, they really do endorse a better quality of life than those who don't exercise. When we've looked at a study, there was a study looking at patients who just simply were using the treadmill. They noticed that over time they had improved gait speed, improved postural instability, their stride and step length was better. So, and that's just one specific form of exercise. So exercise, aerobic exercise can be a lot of different things. Jogging is one. I know not a ton of Parkinson's patients do this, but I do actually still have a handful of former runners who are still doing a little bit. Walking, I don't mind, but I will say I am not a fan of counting walking your dog as form of your exercise. It's a bonus, it's better than sitting on the couch, but for most people, when they're, walking with an animal, they're stopping frequently, it's a little bit more casual. And if you're going to use walking as your form of cardiac exercise, I really want your heart rate getting up. Cycling is a good one, making sure that balance is there. So some patients using a stationary bike or a recumbent bike can provide a little better stability, because again, we don't want your exercise to lead to additional injuries that we have to deal with as well. Swimming is actually one of my favorites. So as I mentioned, a lot of patients have different issues going on, commonly arthritic knees, hips, backs. And so swimming is great because it does take the pressure off of those joints. And it's definitely easier for a lot of patients to get some aerobic exercise instead of pounding on the concrete. And it does not necessarily have to look like swimming laps. I mean, I am pretty active and I still would struggle to swim, for 30 minutes straight. But I always tell patients you could do a lap, then you can grab a kickboard and kick back. You can kind of power walk through a pool. You can buy those water weights that you can do kind of water aerobics, but swimming is really a great one in terms of taking some of that pressure off your joints. Dance, I have a lot of patients that either do tango dance. I have a couple ballroom dance patients. It's great for aerobic, but also working on the coordination component. Tennis, I still have some patients doing that. And actually more recently, I don't know how big pickleball is down by you guys, but I have had a lot of patients doing pickleball. Little caveat to that is being careful. I've seen some injuries, but I think that's whether you have Parkinson's or not. But it is a pretty amazing aerobic exercise, the way you work the lateral movements, which is something that a lot of other forms of exercise don't get. And of course, there's the social aspect to it, which is really great for patients. So that's another one that's become increasingly popular up here. So just a comment to take a little break. Sometimes it's good to change your walking routine, try walking around the block instead of wandering around the kitchen. I kind of just put that because that goes back to my dog thing, because this is always, well, I take the dog out. Taking the dog and like letting them in the front yard does not get to count as your exercise. So I'm a pretty big stickler on that. So forced exercise. So this is interesting. This is actually where a lot of the initial data came from in terms of Parkinson's and exercise. So forced exercise is a mode of aerobic exercise where the participant who's being studied is assisted to achieve a higher and maintain a higher rate than their preferred voluntary rate. So this is something like if you go on a treadmill and you kind of push yourself a little bit faster than you probably would go on your own, or using a tandem bike and having someone kind of pushing you along to go a little bit faster than you would typically go. So the effects of this were really interesting. Like I said, began a lot of research in Parkinson's where a patient was trying to raise awareness for Parkinson's and was riding a tandem bike across the country. And during this, he noticed many of his symptoms started to get better. Things like his tremors were reduced, even his handwriting seemed better. And so she was evaluated based on this and found to have improvement in her physical exam that was documented. So basically, she hadn't been exercised, decides to raise awareness for Parkinson's, riding her tandem bike across the country, and sees all of this a benefit. And so this was really where a lot of the research began to show that forced exercise can impact Parkinson's symptoms, with research showing up to 35% improvement in motor symptoms. So that's huge. I mean, I don't know if anyone in this room's had a levodopa challenge, but sometimes when patients are being evaluated for DBS, what we'll do is have them come off their medications, observe them when they take their medications, and do a score off and on medications. And for DBS, you usually want to see a 33% reduction in symptoms. So this study alone is showing that this woman, just by exercising, nothing to do with her medications, had a 35% improvement in her motor symptoms, which is pretty impressive. And so they looked at this both in human and animal studies. And in the animal studies, they found that there was a release of hormones when this is happening, of this forced exercise, that actually is involved in repairing cell damage, as well as changes in dopamine. So I do stress, when you're exercising, it does not appear that your body's making more dopamine, but what we see is that most likely your body's using either your own or your medication dopamine more efficiently than it would if you were not exercising. Another concept of forced exercise that's kind of becoming big, I think you guys still have this down there, I know some things have changed with COVID, is the pedaling for Parkinson's. And we finally got it up here very recently. But it's basically a similar concept, pushing you to go faster than you probably would do on your own. And it's a great program. And kind of, again, some of these Parkinson's specific programs have the social aspect that has been really rewarding, especially as we all come out of our COVID isolation, and nice to see people again. Let's see if this video will work. So this is regarding
high-speed bicycle pedaling improves Parkinson's symptoms.
Dr. Jay Alberts and the Center for Neurological Restoration have discovered that Parkinson's patients who rode with a trainer pedaling at 80 to 90 RPMs for an hour 3 times a week showed a 35% improvement in motor function. The improvements, while slightly decreased, were still evident 4 weeks after they stopped the pedaling study.
You're bicycling with your legs, and yet we have improvements in the upper extremity function. So it points to some change in brain function. So we may actually be increasing the neurotrophic factors, and as our functional MRI data suggests, that we're actually changing the pattern of cortical and subcortical activation.
And interestingly, the areas that are active in this are the same areas that we see active when we give people Parkinson's medicine, and the same areas that we see active when we use a deep brain stimulator to treat Parkinson's.
So just kind of reiterating what we were mentioning. So let's resistance training. So patients who do resistance training, we see that they have increased muscle strength and endurance, and this likely leads to their improved gait and functional mobility. With age, so whether you have Parkinson's or not, we know that the amount of muscle mass you have over time is inevitable. As you age, it's harder to add more muscle mass, and it's harder to keep what you have. So using resistance training to prevent this loss of muscle mass is very important, whether you have Parkinson's or not. Muscle mass and strength are important for daily activities and to help maintain balance. Additionally, strengthening all those postural muscles helps you to maintain a more upright posture. So again, whether in Parkinson's, we know you want to have that forward flex posture, but if you really work on your core, you're going to be more likely to be upright. And besides just wanting to look like you have better posture, the forward flex posture is one of the reasons Parkinson's can start to lose their balance, because they're uneven now. The weight, your head is heavy. And so if you're leaning forward and looking down and your body gets a little momentum, you are just going to go down. So working on your posture is hugely important. The thing I always stress to patients, it does not have to be heavy weights. I think that's probably part of where we see the sort of patients being nervous about it. So you can use light weights and do a lot of reps. You can add things like resistance bands, or even now they have those, I don't know if they're in Pilates, where you put weights around either your ankles or your wrists and use those. And also you can do things with body weight. So standing and doing squats, using up and out of the chair. So my patients who I really struggle with, I say, if you can just give me that every time a commercial comes on while you're watching TV, you get up and out of the chair 10 to 15 times. I mean, that is really working your glutes and your hip flexors, which is really important for posture stability. So it can look like a lot of things. If you're unsteady, you can use a chair or a counter to help balance you when you're doing those squats. But again, all of these things to work on resistance training. Stretching, and again, this goes for Parkinson's patients, but is also very important with aging. So Parkinson's patients are known to have abnormally flexed posture with shortened flexor muscles, including their hip flexors, hamstrings, and pectoral muscles. This decreased range of motion of the trunk is associated with poor function. Improving this can help. So, you know, it can be stretches that you've gotten through physical therapy. It can be doing some yoga, chair yoga. I'm a huge fan of Pilates, which, you know, can maybe be modified for a Parkinson's patient if needed, because that adds the stretching and the strength component to it. But really it's so important. So in a yoga study, they looked at patients with Parkinson's who did yoga. They saw improvement in their motor scores, balance, flexibility, depression, quality of life measures, and memory scores. So again, exercise is really, really important. And this study with this patients looking at yoga specifically showed all of these improvements. So specific exercise programs, you guys have always had a little bit better options than we have had up towards St. Pete, but we are definitely making headway. So there's lately been a lot of emphasis on doing Parkinson's specific exercise programs, which I think is great. And, you know, a lot of times they are more complicated movements, right? So instead of walking, you're either running in place and doing punches if you're doing the boxing or something like that. And I really do think that those complicated movements help with the balance, the coordination, and really are great programs if that's something that you have available to you. So some specific ones, there has been some tango dancing looked at for Parkinson's patients. So patients that did this for 12 weeks, they saw improvement of their motor functions off medications. So not even taking their medications of 25%. They were noted to have improved balance and overall movement. Tai Chi was another one of the first studies that was published in the New England Journal of Medicine about patients with Parkinson's. And that one, again, showed patients that did this over time had improvement in their gait speed and their stride length. Do you guys have Tai Chi available to you guys down there? Yeah. So that's another one that really, I mean, has really been studied to show benefit for Parkinson's patients specifically. And so here's something on the tango dance.
We've been interested in the walking and balance problems that people with Parkinson's disease experience for several years and have been studying it in the lab. And then I had a graduate student, Madeline Hackney, come to work with me who had experience as a professional dancer. So we had the right combination of skills and patient population to implement this after seeing an abstract at a Society for Neuroscience meeting where they had compared tango to walking for exercise in a group of older people without Parkinson's disease who were at risk for falls. And that poster showed that the tango was superior to walking. So we decided to try it here with people who have Parkinson's disease. What we did was compare traditional exercise classes like those that are currently offered in the community for people with Parkinson's disease to learning to dance tango. So we had a group of people that we recruited and we assigned them to either learn tango or to do a traditional exercise class. We evaluated their walking and balance before they started the classes. Then they completed 20 classes. And at the end of the classes, we reevaluated their walking and balance. And then we could compare any changes that we saw between the two groups to determine which group, if either, resulted in improvements. And we found that the tango group improved far more than the traditional exercise group, particularly with respect to balance. We have several questions that we would like to answer now. One is there something particular about the tango that's important, or would dance in general be beneficial? Another is whether we need people to really dance over a long time period. The 20 lessons that they did in the initial study were completed over a course of 10 weeks. What we're doing right now is what we call dance boot camp, where we're having people dance every day for 2 weeks to see if we can get equivalent effects with a short duration intervention. So big,
I don't know if everyone here has done that, but it's pretty well, or pretty common. So essentially, big physical therapy is a specialized form of physical therapy that's designed specifically for Parkinson's patients. The concept is essentially that in Parkinson's, you want to take smaller movements, so shorter shuffling steps. Your hand movements tend to be smaller, and so what your arm swing is decreased. And what big does is it works on, while you're doing those exercises, over exaggerating the movement. So you make these really wide, big movements when you practice swinging your arms. It's really exaggerated. And the goal is that in real life, you start to make bigger movements. I have found too that it can be really helpful for patients that are having a lot of freezing or difficulty getting in and out of a chair, because the therapists tend to be pretty good at helping work with that. Just going back to this, the thing that I also really like about big therapy, especially for a patient who has not done physical therapy yet, is a therapist has to be certified to do LSVT big therapy. And so the thing that I think is great about that is that you're getting a therapist that's familiar with Parkinson's. I always say all therapists are not created equal. That doesn't mean that one is good or bad, but physical therapy is a huge range of what they can do. And I think to expect one physical therapist to know every condition is probably unrealistic. So if you work with a therapist that's certified in big, that means that they have had at least some exposure, some training, specifically with working with Parkinson's patients. I say, for example, we have PT in our office. They are only neurologic patients. So those therapists are used to working with Parkinson's patients as well as other neurologic diseases. They're not rehabbing a hip or knee from a surgery. So that's not where I would go for that. Likewise, I probably wouldn't go to an orthopedic office to work on my Parkinson's. And then Parkinson's wellness and recovery is when we don't have two available here, but I think you guys might. And it's similar to LSVT big. It was designed by the same creator. It's a little more advanced, focusing on movements that are not only larger, higher amplitude, but it's a little more complicated than the LSVT big. For those of you that have done big, you kind of know it's these set of exercises. And for a lot of my patients, once, maybe twice is kind of all they really want from it, because they can feel that they can keep practicing those exercises on their own. Obviously, that requires the motivation and being diligent about doing it. But for the most part, patients feel that they can kind of continue those exercises on their own. So here's one on the Parkinson's wellness and recovery, which, like I said, is sort of similar to big, but a little bit more involved. So here you see his patient with significant freezing with turning.
Big, big, good, you stopped it, big, bigger than you think, more effort, go, return, right, right. Good. Okay, full turn now, be ready to break, step back big, yeah. That's it, Ellie.
You really see these
Good.
over exaggerated, bigger movements.
Nice, those are nice wide steps, shifting your weight, it looks great. And then turn all the way. That's sweet. Good, perfect. Big side to side. Think of where that chair would be if you're gonna reach. Very beautiful. Good. Right now. Good. Think of that chair. Very nice.
You see how much smoother our walking is around these objects after the therapy.
Good. Turn with those nice turns. Deliberate, big. What happens if you go and back up a few steps now while you do that? Yep, big. Nice. And then forwards, switch directions, very deliberate. Okay, stop, go back. That was a really good stop, like on a dime.
So
Stop.
much smoother movements with the therapy.
Stop. Reverse. Reverse.
The thing I will put on here, I'm okay with backward steps as part of physical therapy, but I always tell my patients in real life, no backward steps, because that's the most common way people fall. So don't take away from this that you should practice walking backwards on your own. Make sure there's someone there to help spot you. So non-motor symptoms. So we always break Parkinson's down into the motor symptoms and the non-motor symptoms. And as you guys know, a lot of times the emphasis really is on motor symptoms, the tremors, the rigidity, the slowness of movement. But when you actually poll patients, the non-motor symptoms sometimes are what the more disabling symptoms are. So depression, memory loss, fatigue, constipation, sleep disturbance. And, you know, I like to touch base on this because, like I said, there's always this huge emphasis and people come in and they always say, all right, doc, what stage am I at? I heard this, there's this staging system. And I'm like, well, I will tell you, but you have to understand something. The Hoehn-Yahr scale, which is what we use for research purposes to stage a patient, is based on motor symptoms alone. So a 0 is no Parkinson's, a 1 is one-sided symptoms, a 2 is two-sided symptoms, a 3 is, you know, a little bit of unsteadiness, a 4 is requiring a walker and cane, and a 5 is bedbound. So first of all, I think those are huge gaps between each of those numbers. And second of all, I would argue you could be a 1, but if you have significant cognitive issues, that's a pretty disabling disease. So one, you know, we use it for research purposes, but I think that there is a lot of neglect to these non-motor symptoms, which really, like I said, can be pretty disabling to patients. So in terms of exercise, we certainly have seen that exercise not only helps those motor symptoms we were talking about, but it helps the non-motor symptoms as well. So we know that depression is common with patients in Parkinson's, and it's not just, oh, you know, feeling sad about your disease, your situation. It's that there's true neurochemical changes taking place in the brain. Obviously, most of the emphasis is on dopamine, which is involved in reward and pleasure, but we know that Parkinson's is not dopamine based only. There's changes in norepinephrine and serotonin. So it is a complicated situation that definitely leads to some of these mood disorders. But we've seen that patients who exercise with Parkinson's and other neurologic disorders see improvement in that depression score. Overall, patients report a greater sense of well-being, and this is at any stage in the disease process. So very important to be active. Memory loss is another non-motor symptom, which can be quite disabling to patients. And we can see it anywhere from kind of mild to debilitating. And it actually needs to be updated. I said eventually 30% of patients will go on to develop dementia. Honestly, some of those numbers are looking higher, more like 50 to 80% of patients are at risk of cognitive issues with the disease. And whether it's Parkinson's related or even Alzheimer's related, we know that regular physical exercise seems to reduce the risk of memory loss in the future. So again, putting all of that effort in now so that you see the benefit of it down the road. Fatigue. Fatigue is the #1 reported non-motor symptom for patients in Parkinson's. And this is for lots of reasons, right? It can be that you're having poor night's sleep and it's affecting you. It could be that your medications make you tired. You could be having issues with your blood pressure making you tired, but we know that it is a very prevalent non-motor symptom for patients. And the studies have shown that regular physical exercise actually helps to reduce this fatigue and actually allows you to sleep better at night. So if you're sedentary all day, it's going to be much harder for your body to get a good night's sleep at night. So getting up, doing that hard exercise, really tiring your body out will give you a better, more sound night of sleep. Constipation, another big common non-motor symptom in Parkinson's. So again, part of the disease, but also a side effect of some of the medications. And up to 50% of patients with Parkinson's start to develop constipation at some point in their disease. But we know that, patients with constipation, they have bloating, they have abdominal discomfort, but we also know that your medications are absorbed in your gut. So if your gut's not moving properly, your medications may not be as beneficial as they could be. And by regular physical exercise, along with water and diet changes, you can see a significant reduction in constipation than those with a sedentary lifestyle. So this is where a lot of the research is really looking. What's happening in your brain when you exercise? We know that Parkinson's is defined by progressive loss of dopamine in your brain and back in the area of the substantia nigra. And there's been a lot of effort looking at what is happening to the dopamine when you're exercising. So I kind of touched on this before. When you exercise, your brain is not increasing dopamine production, but it is influencing the way your brain is using that dopamine. And it appears that it's using it more efficiently, whether it's from your medications or your own natural production of dopamine, which allows your symptoms to be better controlled. So this is the other hot topic in Parkinson's is neuroprotective, right? We have a ton of medications that are designed to treat the symptoms, but nothing is FDA approved to slow the progression of the disease down. And so neuroprotection means any treatment that is either slowing it down or stopping the progress of the disease. And there has been a lot of data looking at patients who exercise seem to have a slower progression of the disease. And, of course, exercise is important at any point in the disease. But, my newer patients who have less motor disease burden, I say now is the time. Put the effort in now so you reap the benefits of that neuroprotection down the road. So when to start now, at any point of the disease, you should be exercising. And sometimes that's going to look different. So you can start before there's a problem, right? Early in the disease, try to, avoid progression. If you're noticing a problem, let's say all of a sudden you're starting to have symptoms of maybe a little bit of imbalance, working with a therapist to how can we recover from these imbalance issues that are present. You also want to preserve what you have. So we talked a lot about muscle mass. You want to keep what you have, and you want to also prevent any new problems from arising. So there's a lot of reasons to exercise, and like I said, it may look different at different points in the disease, but at every point you are going to have some benefit from it. So I always say, first and foremost, you need to be cleared by your doctor to start an exercise program. So, and it's not necessarily your neurologist. I think any of your movement disorder doctors would tell you that they want you to exercise. But again, other patients can have cardiac issues or other issues. So it's important that all your doctors know what you're intending to do so that we make sure you're doing it safely. If you're a patient that really has not been active in a while, I think physical therapy is a great spot to start. It is a trained person teaching you what to do. I love physical therapy, but the downfall to physical therapy is that insurance does not cover it indefinitely. So there has to be a plan once the sessions are done. I see this all the time where patients come to see me at an appointment and they're mid-therapy and they're doing great. And, they talk about how much better they feel doing it. And then the therapy ends. And at first they're kind of doing maybe 90% of the exercises, then 50% of the exercises, and it starts to trickle down and we're back to where we started. And this may sound harsh, but I tell patients, if you're not going to stick with the exercises, it's a waste of your time and your therapist's time. I'm sure the therapists are down there are just as busy here. So you've got to make the commitment not to just do the sessions, but to stick with it. Another thing is working with a personal trainer. Again, I like patients, trainers that are a little more familiar with Parkinson's, because I've seen sometimes trainers pushing things that I probably wouldn't recommend. But if you're going to go to a gym and you want to try doing some weights and you haven't done that in a long time, do it with somebody who knows how to do it. That way you're not going to injure yourself. I would rather you start off slow and gradually build up in terms of frequency and weights you're doing and repetitions without having an injury, because once you injure yourself, that's another setback that we don't need to have. And like I said, you can switch it up, but having someone kind of show you the ropes is hugely important, especially if you have not been doing exercise. So making the most of your workout. Number one, limit distractions. I personally am a morning exercise person. I feel like as the day goes on, there's always an excuse of why you can't do it. Not every patient's going to feel that way, but finding a time of day that is your best time of day, that's most likely when you're going to get that workout in, is important, and setting it as your priority. So, we've talked before, most patients with Parkinson's sort of know, usually for patients, to me, from what I've heard, the feedback, morning is their best time of day. Of course, I have some patients that swear afternoon is their best time of day. But when you feel your best is when you should be exercising, because you're going to get more out of your workout. That being said, you also want to make sure your medications are working. So trying to do an exercise at the end of your dose, you're probably not going to get as much medication, or as much benefit from the program. So definitely maximizing your best time of day, making sure your medications are working will really help improve what you can get out of your exercise program. And like I said, it's just as important as your medications. So you've got to make a commitment to it. What I see from a lot of Floridians is during this time of year, they have a ton of guests coming down from up north that want to take advantage of a free place to stay in Florida during their spring break. And so patients will tell me, well, we've had guests, so I haven't been exercising. It just can't be an excuse. I ask for patients a minimum of 30 minutes a day. You say to your guest, hey, it's just like a treatment of mine for my disease. I've got to get it in, and then I'm ready to hang and, get together. It's hard to get motivated, whether you have Parkinson's or not, but when you have Parkinson's, apathy is an added component that makes this sort of an uphill battle at times. So number one, we talked about a lot of exercises. At the end of the day, I want you to enjoy it. If you do not enjoy it, you will not stick with it. That's just the way it is. So try different things, be open to it, and, find what you like doing. Add variety. No one wants to do the same thing every day. So I think it's really important from both the motor benefit you get, as well as, not getting sick of it. Make it part of your routine. We've kind of talked about that. Exercise with a friend, a spouse, or some of these group programs can be really motivating. I know, like my patients that do boxing, if someone doesn't show up, they text them and say, where were you? And I think that's great to hold each other accountable about it. Make sure you also have realistic goals. If you have not been exercising for years, I don't think you are all of a sudden going to be exercising 30 minutes, 5 days a week. Make it realistic goals, add on to those goals, and slowly build up to them. And then make sure you're telling people like, hey, this is what I need to be doing. Make sure you're checking in with me and holding me accountable. So what fits into your busy schedule? Exercising 1 hour a day or being dead for 24 hours a day. It sounds a little bit harsh, but I'm telling you, you will have a better course of this disease if you add the exercise component to it. And, listen, I personally obviously do not have Parkinson's. I don't know what it's like to be in your shoes, but this is the one thing you have control over that will make a difference in the quality of your life. And then if it doesn't challenge you, it doesn't change you. If this is easy breezy exercise, you need to step it up. So, like I said, I have patients where I'm like, I know you could be doing more. You're probably not getting as much benefit from it. So push yourself. You're always capable of a little more than you think of. Obviously, I want you to be safe, but I do think the greater benefit I see in patients who exercise are the ones that are truly pushing themselves. And that's it.
Thank you very much for that presentation, Dr. Herrema. It gives us a lot of food for thought. I think all of us really know the importance of exercise. I always tell people when they first join either this group or another group that like you said, the best exercise is the one that you'll do. And you have to find something that you enjoy. Like for me, it's pickleball. I've fallen in love with pickleball. So that's one of the things that I do. But I also do interval walking training. I try to do some strength training. I ride my exercise bike. So like you said, mix it up. All right. Well, can you just stop sharing your screen, Dr. Herrema?
Yeah.
And then I will, all right. So we'll open it up for Q&A. So either you can just raise your physical hand or your virtual hand. If you have a question for Dr. Herrema on the topic we were discussing today about exercise, or it could be something else related to that. If you have a question for Dr. Herrema. Oh, everybody's shy today. Linda, you have to unmute yourself, Linda.
I recently pulled my hamstring, and it's not severe now, it's getting better. But should I, should I exercise gently when I start again today?
Yeah, absolutely. I mean, and this is again, whether you have Parkinson's or not, if you have an injury, you want to really ease back into that. And if right now all you can do is sit and do some upper body strength, you can modify it so that you're still getting something in. But yeah, I would definitely ease back into it.
Okay, thank you.
Rich Cada, go ahead. Have to unmute yourself, Rich. There you go.
Thank you, Doctor, for your presentation. A couple of things that struck me was the LSVT therapy. And Roger, maybe you can include this. I'd just like to get some more information on that.
So your neurologist should know where some local places are, but there's a website called lsvtglobal.com. If you go there, you can put in your zip code, and then you can do a mile radius, and it will give you certified therapists within the area. I didn't really touch on LSVT loud just because we're focusing on exercise, but LSVT big is the physical therapy version of it. LSVT loud is the speech therapy version of it. So that information will be on the website as well.
Good. Could you repeat the website?
Yep. LSVT, V as in Victor, global.com.
I'll put it in the meeting minutes, and I'll just really briefly share my personal experience with LSVT. So I was diagnosed in July 2017, and I saw a physical therapist near where I was still working in September. So what she did before I ever started the program, she had me walk around the parking lot, and she took a video of me. And I looked like an 80-year-old man shuffling. And after 4 weeks, 4 times a day, after that, she took another video, and then before and after difference was like night and day. It was like I went from being an 80-year-old man to a 30-year-old man. So it's a great program. I still do the exercises when I need a little more workout. I do that exercise. Those exercises are just great. Daryl asked a question. Any exercises that are not suggested? I don't see rowing mentioned, he said.
Yeah, I don't know that I've ever seen any studies specific on rowing, but I don't see there to be any problem. The only thing I would say as far as exercises that are not suggested is when you have impaired balance and you're doing something that is challenging that and there's no safety. So, I mean, going out and riding the Pinellas bike trail, if you're really unsteady on a bike, it's just not safe. If you're so then switching it more to a stationary bike, or if you're going to be doing certain balance exercises, making sure you have a spot, those types of things. But really, it's just anything that doesn't seem safe. Otherwise, there's, no restrictions.
And Daryl said, I thought forced exercise meant at gunpoint.
A different version of forced exercise, yes.
Thanks, Daryl. All right, Robert, you have to admit yourself, Robert Stolt. There you go.
Yeah, thank you for a great presentation. I do sports 3 times a week through Zoom with a coach, and it makes a big difference in my life. I think to live well, we need to make an effort to be mentally, physically, and socially active on all 3 fronts, and that keeps the brain involved. And exercise makes a huge difference in my life.
Absolutely.
And I didn't know about the resistance training, so that's a good one for me to add.
Yeah.
So thank you for that.
Yeah, I mean, the social aspects of the exercise programs, I think, are really undervalued. But, here I see a lot of times they'll do boxing and then they'll go out to lunch together. And I mean, I think it's so important not just to have peers that are going through same things as you, which is a huge factor. But, this is just my own personal experience. COVID really taught me what isolation does to a patient with memory. So in my office, typically there's a test called the MOCA I do once a year on patients, and there's a score out of 30 that they get. And what I saw was the patients who were maybe kind of teetering, maybe a little bit abnormal, their memory scores tanked. The more isolated they were, the more it tanked. And so I think that there will probably be some studies that come out about how important socialization is in terms of memory loss. I know it's a little bit off the topic of what we're talking about, but I really think it's super important.
Yeah, we talked about that actually at some previous meeting. We talked about the Surgeon General's take on isolation, how it's a health crisis, it's an epidemic.
Yeah.
So the more you can interact, and if you can combine with exercise, that's even better.
Yeah, I mean, apathy is real in Parkinson's. So sometimes the motivation to get out and do those things is really hard. And I a lot of times see this debate between spouses because one wants to be super social, the other doesn't. And I think, you have to keep in mind it might look a little different. It doesn't have to be a huge dinner party. Going out to dinner with another couple or having coffee with 1 or 2 friends may be what a patient feels more comfortable with, but it really is important. And because it was like sort of just one of these things I started to see, like, whoa, what's going on here? And then I talked to my partners, and then I've talked to, colleagues across the country who are probably more isolated than we were here in Florida. And it really has been devastating. And I think for some patients, it's been hard for them because it gave them an excuse to do it for a while. It's been hard to break that, but it really is important.
Yeah, I find you can't wait for a solution. You need to put an effort in on all 3 fronts, and that changes the quality of life. So don't expect anything to happen. You need to work for it, unfortunately, on all fronts, but then you get the rewards from it. That's what I find.
Well put, Robert. Well put. Thank you. All right. Does anybody else have a question or something they'd like to ask Dr. Herrema while we're all together? Just scanning around looking for hands. Oh, I see Mark Spivak. Hey, he's doing his boxing. All right, Mark, way to go. He brought exercise to the meeting. That's what I call initiative. All right. Anybody else while we have everybody here? Oh, Rich, go ahead. You have to mute yourself, Rich. There you go.
So the treadmill piece that you just showed was interesting to me. I've used the treadmill a lot before, but since I've had PD, I tend not to use it so much because I feel uncomfortable, and trying to run. But I see there are exercises that are not necessarily running. It's just like slow steps, about side to side, that kind of thing. So that motivated me to get back to working on a treadmill. So
yeah, for some patients, the treadmill is a little intimidating because obviously if you get going too fast and you lose control, that's not safe. And obviously the person in the video had a spot right there as well. But it doesn't, again, I mean, even doing a treadmill at a slow rate, but an incline is a great workout. It can look different. It doesn't have to be running on a treadmill.
And I also, did a lot more, I'm trying to do more walking and also jogging. And generally my wife is with me, so she makes sure that sometimes I get going too fast.
Yeah.
And so she says, slow down, and that's good for me. So
Absolutely.
I was
That's
telling
good.
the group before the meeting that I watched a video yesterday about a new program called interval walking training. So it's like high intensity training, but for walking. And it's basically 3 minutes of really casual, slow walking and 3 minutes of really heart pumping, swinging your hands for 3 minutes as you do 5 sets. I did that yesterday. I got back to the house. I was completely soaked. And my Apple Watch said I burned 280 calories. So it's a good program. I'll include the video in the follow-up email to the group. Honey, you had your hand up? Can't forget my wife.
No, it was on the same thing. I just wanted for the benefit of the whole group because we spoke about it earlier. But I was impressed with that power when the woman was walking backwards, when she had been freezing. And I was like, wow, what a difference. I mean, personally, I would have had trouble going around all those obstacles. And I don't
Yeah.
have Parkinson's, but it really improved her. And I was looking up if there's one local, which if there is one, we'll include it in the email. Thank
Yeah,
you,
if you live
Dr.
in
Herrema.
Sarasota, the Health Fit on Sarasota off of Clark Road, Rand Boulevard, they have Power for Parkinson's 3 days a week, and they have spinning for Parkinson's 2 days a week, and they have Power Moves 3 days a week. So Power Moves, Rock Steady Boxing, and cycling with Parkinson's, all out of that one facility. If you live in this area, it's a really nice program.
And just to kind of plug for those programs, I mean, what I tell, and again, you guys have way more available to you than we do up in St. Pete, but when people don't show to those programs, the funding goes away. And so I just really stress to give them a try. Again, if it's not your thing, that's fine. I get everyone feels differently about group exercise, but one, I think there's a lot of benefit to be had. And two, when patients go, that's when they keep adding. I mean, that's kind of what happened for us was there was one program called Total Parkinson's that got started and it blew up and patients were going. And then off of that, we've had a catalyst of several other programs. Again, you guys have a lot more available to you than we've had up here in St. Pete, but I really encourage you to show up because that's what they're looking for. They're looking to make sure it's worth their time and effort.
Exactly. And that's this case like with neuro challenge programs, they have programs all the way from St. Pete down to Sebring.
Yeah.
But if people don't show up for the programs, then they won't keep them going. So you have to be showing up. Linda, did you have your hand up? I saw your hand up. You have to unmute yourself. Oh, I'm sorry. I messed you up. Go ahead. Try. Yeah. There you go.
Agility, whatever you call it, offers the Big and Loud. It's on
Agility
Pine
therapy.
Grove in
Yep.
Venice. So if anybody needs it, they're good.
Yeah, it's a great place for PT. I went there when I had problems with my shoulder with playing pickleball, and like Linda said, they do LSVT there. Right, it's right off of Pine Brook and East Venice Avenue.
Yep.
Thanks, Linda. All right, anybody else have their hand up? I missed anybody? Oh, Mark Spivak, you have to mute yourself, Mark. You're all done boxing, buddy. There you go.
I also did 30 minutes on a new step.
Oh, nice.
How's it?
That's great, man. Keep it up. You're looking
I'll do that
good.
during the meeting.
That's it, man. Thanks for sharing that. All right. Anybody else real quick while you're all together? Good to see you, Eddie, all the way from Peru. You're looking good, my friend.
Yeah, I'm still alive. Yeah. I just
So, do
wish
you have
there
another-
was some of these things in
I know, Peru, they don't have it.
I still haven't found anything concerning Parkinson's specifically for rehabilitation, for exercise, for anything.
Yeah, you're probably your best bet, Eddie, and I can share some stuff with you specifically, but is doing Zoom. Most of the programs at Parkinson's Place in Sarasota are on Zoom, but there are a lot of other organizations like Dance for PD, that's all on Zoom. Rock Steady Boxing has stuff on Zoom. So I can give you some pointers on where to look for some exercise programs you can do on Zoom and in your time zone.
Right, yes, gracias.
No problem. Honey, do you have your hand up again?
I just wanted Dr. Herrema's thought on what Edie's gonna be doing with the pole walking, because it engages your arms and your legs. And is that something that is better to do than just regular walking?
Okay, so doing it just for exercise, you're saying?
Yeah, it's
yeah, one of our members, she's certified with Davis Finney Group.
Yeah.
I'll let Edie, can you unmute yourself to tell Dr. Herrema a little bit about the program? We're working on trying to find a place to do it indoors in the.
Yeah, I don't know that I'd be curious about it. I don't know that much about it, so I'd be curious her.
Go ahead, Edie.
It's called urban polling, and it's using poles that they're like Nordic walking poles, only they've been modified to be more ergonomically designed for people who have movement disorders. And the idea is that you kind of step up your exercise, with using your arms and your legs. It's kind of like the idea of using a stationary bike that also has the arms going. So it just improves makes better use of your energy as you're exercising, and it helps with your core strength. It's really good for postural issues because using the poles makes you stand up straight as opposed to leaning into a cane or leaning forward with a walker. So we're just,
yeah, I mean, I don't know anything about it, but it sounds great. I mean, I would actually be curious if you see improvement in arm swing afterwards.
I think you do, because I've been doing it now regularly for several months, and because you are moving the arms with the poles on purpose, and have to establish a rhythm because you have to do opposite hand at opposite foot, and as and I find myself, it becomes more rhythmic, and I think it does help with the
I
arms.
see that being a good benefit to it.
Yeah. But there's a company, if you you Google or you go to urbanpolling.com, and it tells you about the program.
Nice. Thanks for
And we're
sharing.
hoping to find an air-conditioned space to do it indoors. We got our feelers out for a couple places. All right. Anybody else have a question while we're all still together before we let busy Dr. Herrema go? All right. I guess it's a quiet group this morning. Usually they're a little bit more vocal. So again, we want to thank you very much, Dr. Herrema, for coming. We really appreciated that presentation. Great food for thought and good stuff for us to continue to work on improving the quality of our health by means of regular exercise.
Yeah, absolutely. Thank you for having me. You guys have a great day. And you guys are doing great work by getting together, being educated and knowledgeable about your Parkinson's. That always leads to better conversations with your doctor. So kudos to you guys, and enjoy this nice weather before it gets real hot.
All right. And I'll see you Monday up at your
Sounds
office.
good. All right. Bye-bye.
All right.